Good evening, everyone, and welcome to today's panel discussion. I'm very excited for today's panel discussion because we are going to discuss a very exciting topic. And the topic of today's panel discussion will be the impact of cannabis education in healthcare and where we are standing now. As we all know that we are working and we are fighting globally for this plant to give the recognition that what the plant needs, that because there are so much research and so much evidences are already there, and so much medical benefit that we are seeing from decades, that is still that we are not there where we should be. So today we are going to discuss this interesting topic with three of our interesting and very expert in the field of medical cannabis from a long time. So I'm going to introduce them, but before that I welcome you, all of you, at Morehouse School of Medicine online education program, at our medical cannabis therapeutic master's program. Myself, Dr. Bed, and I've been working in the field from last 15 years in various different aspects, especially focusing on education and cannabis testing for a long time. And we have three experts in the field, and one is Akila Easter, and she is one of the medical cannabis education activist here at City College of Chicago, and she is a tenure associate professor where she runs the medical cannabis the education program there. Welcome, Akila. And the another guest is Amanda Raymond. And Dr. Raymond is a pioneer in the field of medical cannabis with the public policy and harm reduction. She published the first study to survey the medical cannabis patients from inside the dispensary and some of the earliest research on medical cannabis dispensaries. Welcome, Amanda. And the third guest is Peter Grimspoon, and it's an honor to have you all here. Peter, being a amazing clinicians, great medical cannabis supporter, and being working in the field for such a long time with his knowledge, and to enlighten so many people with his medical experience, who is actively involved in this field, to working with so many different aspects of medical cannabis. So it will be very interesting to get a lot of different aspect and different experience of our guest to talk about the quality of the education and how it is impacting the healthcare education. But before we move forward with all these details, let's ask our guests to introduce themselves and to tell us that little bit about their journey of medical cannabis. And then after that, we will move forward and we'll start with Peter.
Oh, okay. So I'm Peter Grinspoon. It's great to be here. Thanks for having me. I became interested in medical cannabis a very long time ago. My brother Danny, when I was a little kid, was fighting an unsuccessful battle with leukemia, and in the early 1970s, my parents bought him cannabis illegally because they had heard that it might help him, and it really made a tremendous difference to his quality of life. With chemotherapy, for the last year of his life, he could really hold down food and sort of not be sick all the time. So it didn't help him survive the cancer, but it really vastly improved his quality of life. So I've been interested in it my whole life, and I've been taking care of medical cannabis patients for the last 25 years as a primary care doctor.
Thank you so much, Peter, for this introduction. So, Dean Easter.
Yes. Hi again. My name is Akila Easter. I'm in Chicago, Illinois. I'm the dean of a new department in urban agriculture, and the entryway was cannabis. So they say it's entry drug, but it's not an entry drug, right? But I got interested in cannabis in high school when I wrote my first report on why THC should be legal, and almost got kicked out of school. So that's where, when I was 15 years old, where I started to get a better understanding of what prohibition is and things such as that. And also led me into science. So I'm a biologist and a physiologist. So I like to understand how it interacts within the body. And that's where we created our curriculum based out of. A lot of the education material is more how do you grow the cannabis plant. And so we wanted to kind of figure out how we can get particularly Black and Brown students a different angle to where they can understand the science behind the plant and be able to articulate and talk about a plant that's probably impacted their family lives based on the war on drugs. So that's where we are with our institution.
Thank you so much, Akila Easter. And now Amanda Raymond.
Well, it's wonderful to be here. I really appreciate the opportunity to have this discussion. So I started working in cannabis in the late 90s as an activist living in Chicago, and, very, very prohibited in the late 90s in Chicago. And I'm a social worker. So my approach to cannabis has really been from the social justice angle and looking at the negative impacts of prohibition, especially on vulnerable communities and communities that have been targeted by the war on drugs. In 2002, I moved to Oakland, California to start my PhD in social welfare at Berkeley and fell into this world of medical cannabis that I knew nothing about being back in Chicago. But there were dispensaries and there were patients and there were people that were accessing medical cannabis and community health services through dispensaries. And so I decided to study this for my doctoral dissertation. I thought it was very unique to health services in general and social services in general to see people be able to access cannabis and also get free massage and acupuncture and legal help and entertainment and fresh food. It was a really interesting model of community care. So that's why I started studying that. And through my early research, found the use of cannabis as a harm reduction tool and people using cannabis to move away from alcohol, opiates, and other drugs, and even as a recovery tool for people that had problematic use of these substances. So that's really what I've been studying for the past 20 years. Currently, I'm the Chief Knowledge Officer at New Frontier Data, which is a data and analytics company that serves the legal cannabis industry.
Thank you so much, Amanda. And what a great evening with all of you three, that we are bringing a very different experience, the scientific experience, the social work experience, as well as the healthcare experience. So it's being kind of like a really good discussion. It will happen. So the first question that what we are going to talk about, because we all know that, like now that globally we have so much data, 38 states are already medically approved, and it is going through the mainstream in so many different universities and medical colleges. So the question that what we ask always and what we wanted to discuss today is, what are the current perceptions and attitudes towards the medical cannabis within the healthcare community? Because like, it's not about it being taboo from such a long time. It's not about only the consumers, the customers, but there are so much hesitation for the healthcare professionals to use medical cannabis, and either it is nurses, or either it is pharma D, either it is MDs. And again, it's end of the day that which comes to that, like policies and regulations, but also the one of the most important and critical part is to educate them to understand these policies, to understand the medical value, the understand about the plant, the understand about the various different products and how to utilize them, and the current state of research, not only about the treating the patients, but also the basic fundamental most important part is the interaction between the endocannabinoid system with phytocannabinoids. That's are really, really critical. So I think that we will start with Peter to hear his thoughts, that what do you think about the current perceptions and attitudes towards the medical cannabis within the healthcare community?
Well, I can mostly speak to doctors, but I think that it's pretty comparable with doctors and nurses and other healthcare providers like physician assistants and nurse practitioners. My experience is that the perception of a particular physician about medical cannabis sort of depends on his or her vantage point. On the one extreme, the oncologist, I've seen polls that show that 90% of oncologists are in favor of medical cannabis because they see their patients, very sick on chemotherapy, just like my brother Danny, doing well with the nausea, the insomnia, the anxiety, the pain. On the other extreme is for example, the adolescent psychiatrists. You see the rare but very tragic cases of, a young person smoking cannabis and that either triggering, destabilizing, or worsening some kind of psychosis. And they tend to generalize their experience and they think cannabis is very dangerous. I think the experience of most doctors and nurses is somewhere in between those two poles. When I was writing my recent book, Seeing Through the Smoke, the poll I saw of like primary care doctors was that about 2/3 of them believed that cannabis was a helpful medication, at least for some components. The irony of all of this as a primary care doctor is that cannabis is really helpful for people, not for everybody, but for a lot of people, for some of the most difficult things that we treat, such as like chronic pain, anxiety, and insomnia. And these are all things that we treat that don't have a lot of great pharmaceutical treatments as well. Look at chronic pain. What are you going to treat chronic pain with? Nobody wants to be on opiates, and nonsteroidals will kill your kidneys if they don't give you a heart attack. So ironically, it makes my life a lot easier as a sort of overworked, beleaguered primary care doctor to be able to use medical cannabis, because it's a relatively non-toxic, and very helpful medication for many of my patients. So I think that slowly but surely, as we get out from the shadow of the war on drugs, doctors and nurses are coming around, both because they're learning more about the endocannabinoid system, and they're seeing more unbiased research, but also because they're listening to their patients, and they're hearing, at least the good doctors listen, and they're hearing from their patients about how exactly it helps them.
Thank you, Peter. And it's a great point that what you mentioned is that overall, that like what I am getting from your perspective is that like it's not only about the education of the doctors or nurses or practitioners, but also that important that the patients who are coming, that if they are educated also, then they can also convince their medical practitioner that what's going on and what I need, and why I need that. Because again, that it's all about that like what kind of patients is going to the doctor, and for what reason that they are asking for medical cannabis. Because you can use medical cannabis in cancer patients in 10 different ways. So it's all about that like what they need. So I wanted to hear about this same perspective from our two other guests, and we will start from Akila Easter.
Well, I find that with everything that happened recently with COVID, people became more advocates for themselves, right? So some people just heard of the CDC and public health realm and things like that, what a public health officer is. And they wanted to be able to advocate. I find a lot of my students are in our program because they went to the doctor, and the doctor has been dismissing them, dismissing their symptoms, no actual cure, just keep taking this, and even nothing is really happening. So I think that's where a lot of the push right now is coming from, particularly with our students. It's the restorative justice component, where they know that this drug has affected a family member. And I'll tell a personal story. My sister went to prison for cannabis, right? So having that emotional connection, and understanding, when I know about this plant, and she's locked up for this, right? So that's a lot of a common story with our students. They want to advocate for themselves, and they have a close member a family member who's been affected. And then from our cultural wise, from African American culture wise, we've done a lot of holistic medicine for a long time and had some mistrust with the medical realm. So that has kind of led us down a path of trying to figure out what our cures can be. And we've been doing this for a long, long time, but now students are understanding the science behind why this is working. And telling doctors and no offense, but telling doctors what to do in something that they've gone to school for 8+ years for, that's a hard thing to challenge. And you have to have a certain level of confidence to be able to walk into an office and advocate for yourselves. So that's where I'm finding a lot of this. This is turning the curve, where a lot of students are becoming stronger. Now I tell them, you're not a doctor, you're not a pharmacist, right? So be humble yourself, but you still know some of the things that you should be looking for when you understand this plant.
Thank you so much. This is such an interesting perspective. And two things that what you mentioned, and one thing that I experienced in my so many classes, and recently actually experienced when I was teaching at Olive Harvey, that one of the student, and he has inflammatory bowel disease, and he mentioned that like Dr. Bed, I learned so much from your class, and I'm talking with my doctor, because he is continuously telling me that like no, you can't use it, and there kind of like a lot of stigma, and not a lot, but now I'm showing a lot of research that what is happening in the field of medical cannabis related to inflammatory bowel disease is amazing. That how we are utilizing the existing research to educate ourselves and to the others also. And again, the second thing that what you mentioned is to like this having possession of medical marijuana and going to the jail, it being happening for such a long time, that it is now that where we are, and when we see that still it is happening, it's really painful to see that, because this is such a valuable plant, and it is doing wonders all over the world. And when people talk about that, this plant has a side effect, I always challenge them. Water has a side effect. You drink 15 glass of water, your body is going to puke and tell that no, it is 15 glass, you don't need that, you need 2 glasses or 3 glasses. So that means you are taking something beyond and above, and that's why I'm rejecting you. So it's a simple phenomena that until unless we know with the help of the education, the positive and negative of any drug, including medical cannabis, then clinicians can effectively and efficiently use that drug in any way. Amanda, your perspective.
Yeah, well, I'm going to talk about behavioral health. And there's a slightly different angle when we talk about behavioral health care. So, people that are psychiatrists, psychologists, addiction professionals, social workers, in that they're really focused on, the brain, right, and how people's brains are functioning. And I think that for such a long time, one of the major claims around cannabis was its impact on thinking, its impact on the ability to rationalize, its impact on the ability to be sane, to make good decisions. And a lot of this was really ingrained into the training that behavioral health care providers have. We have the DSM, the Holy Bible of medical diagnoses, and it is very clear about addiction. And when cannabis didn't fit into the typical, framework for addiction, they just invented a new disorder for it called cannabis use disorder, which was more of a catch-all because cannabis didn't really fit into addiction. But that's the framework with which they operate. Now, social workers are slightly different. We really come from the person and environment perspective. So we're not like psychiatrists or psychologists where we're just looking at the brain and the individual as the framework. We're looking at the context of the individual in society, how their community, their family, the policies that impact them. And social work really has embraced the concept of harm reduction and this idea that there are a lot of ways to help a client improve the quality of their life, whether or not abstinence is on that list. So I do think that when it comes to policy, social work supports decriminalization. They understand the negative impacts of the collateral sanctions associated with having a drug charge. However, when it comes to the perspective of use, I think a lot of behavioral health folks say there are so many barriers to health for this client. Family, their environment that they're living in, the housing that they're living in, the job that they have or don't have. Why add an intoxicating substance to the mix? That's only going to complicate things for them. And even if they may not believe it complicates things for them personally, they will believe that if they get drug tested or if they get caught using in public housing, or if it furthers the divide between them and their family, that it's not going to be helpful. That it's just going to cause more issues. And so I think this has been the perspective. And, speaking to what was said before, a lot of these folks have been trained up on this very antiquated way of thinking about drug use. I mean, it's really only very recently that we've been able to have conversations outside of incarceration and criminal justice involvement and addiction when it comes to drugs outside of alcohol. And you look at the state of Oregon, for example, that decriminalized drugs, which was a great move, and then recriminalized them. It was like we just weren't ready to talk about people who use drugs outside of alcohol as productive members of society, that where criminal justice is not the best way to help them. And I think for a lot of behavioral health folks, they're still there. And when we talk about acceptable uses for cannabis, I think doctors are way more willing, and Peter, correct me if I'm wrong, but doctors are way more willing to support the use of cannabis for something like epilepsy or for something like chronic pain than for something like anxiety or depression, or, more of a mental health issue, because of the framing of cannabis and all drugs as doing nothing but exacerbating mental health issues, even if they may provide some kind of short-term relief.
No, I think I totally agree with you that, like in that area, there's a lot of work need to be done with respect to the policy changes, with respect to the training, with respect to the educating the people that who are in that area. But along with that, again, that it's a long way that what we are coming from. Still, the plant is sitting on Schedule 1, so it's a long battle for us. So thank you for these great perspectives. And the next question that what we are going to talk about, that I wanted to get perspective from you all, that how has cannabis education evolved within the healthcare system from recent 10 to 15 years or 20 years with compared to last 50 to 60 years. that what you guys think about that. Peter, I can see that your excitement and to answer this question. So please go ahead and tell us your thoughts.
Well, it's definitely getting better, but we have a long ways to go. They don't teach the endocannabinoid system in many, if not most, medical schools. The last poll I saw was from 2013, where they only taught it in 13% of medical schools. Hopefully, it's a little bit better. I mean, that's really crazy. Even if you're like anti-cannabis, like think it's like satanic lettuce, you should understand like the endocannabinoid system, so you could explain why it's bad. And even if you're agnostic about cannabis, the endocannabinoid system explains so many other things in the body and so many other like critical body processes that it just doesn't make any sense to me. Now, the education in medical school used to be very cursory and sort of negative. Like when I was in medical school, it was just like, it was really under the like the drugs of abuse section. And then they had to give a little bit of lip service to like people using it for chemotherapy because they couldn't ignore that completely. And I think now what's different is that medical students and interns and residents and junior faculty are now like very hungry for good information about cannabis. And a lot of doctors and nurses are getting caught flat-footed in these discussions that their patients are very eager and just, expecting their doctor to have a sensible, like know enough about it to have a sensible discussion. And the doctors are really being caught flat-footed and not knowing anything helpful about it. So I think there's a lot of pressure to educate doctors, both like externally from patients and internally from the students and the younger doctors to get their act together for medical schools to teach doctors more about cannabis. The one major complication or difficulty is that, I work for this policy group and they were talking about coming up with a competency for doctors for medical cannabis. And I'm like, how are you going to do that if doctors don't agree about cannabis? Like, to allude to a point that Amanda made a little bit earlier, like the psychiatrist just came out in an article last year in the American Journal of Public Health saying the cannabis makes anxiety, depression, PTSD, and psychosis worse and should never be used for any of those. And, I sort of agree about the psychosis, but the other three, absolutely not true. I mean, the people who wrote this, of course, don't treat anybody with medical cannabis. They don't get to see patients actually doing a lot better with all of these conditions. Not everybody does better, but a lot of people do better. So I think that, the more we can come up with common ground, the endocannabinoid system would be a great place to start because that's sort of like a neutral neurotransmitter system. There's nothing, but I also think that like most people could agree that, cannabis helps with pain, anxiety, insomnia, chemotherapy. And most people could agree that we should be very careful in pregnancy, breastfeeding, with teenagers, and in people with a history of psychosis. Like, I think there is more common ground than we all give ourselves credit for with cannabis.
No, I totally agree with you, Peter. And one of the most important thing that what I always thought about that, the endocannabinoid system, which is the most ignored area that, like I always feel like, because when I created CMEs for various different universities and medical colleges, that, like it's always the challenge because, like everybody thinks that, like they can take 1 hour or 2 hour class and they are the expert of endocannabinoid system, but it's not. It's such a big ocean that, like, and every day that the research articles are coming that is showing that, how important it is. And even like you said that it is the not about the medical cannabis, but it is one of the system in our body that medical students should learn about, because they are learning about all other medical all other systems in our body, either reproductive system or XYZ. Then why not endocannabinoid system? And automatically that will be the best start to kind of like motivate everyone. But one key thing that what you mentioned is that the pressure is coming because, like we all are involved in the medical cannabis education. And like Dean mentioned that, like that now students are taking this education and kind of like, like arguing or kind of like putting their point that, no, I have so many different evidences in my hand that, like which shows that, like it is helpful. I have research paper, I have clinical trial, you have to look on that. And then after that you have to give me the opportunity to, like okay, write down the things, and then, like see that, what, how I'm going to respond to that, because that's really really critical. So, and in that case that, like a medical doctor has a lot of pressure to learn about the whole thing, as well as that, like to understand that what is the need of the patients is really really critical. But one of the thing that which is really comes that when we are in a medical practice is that the challenges for the healthcare professional who face when discussing the medical cannabis with the patients, because, again, it comes with so many different angles, that the challenges that either nurses or MDs and or either nurse practitioners they are facing. So what do you think, Amanda, about that? What are the challenges that medical practitioners are seeing every day when they are treating the patients and when they are trying to use medical cannabis? So what kind of challenges they are having?
Well, I think Peter really said it, is that you have such a variety of opinions and stances on cannabis. So when we talk about like a continuum of care, where you have a multidisciplinary team involved, and you may have a social worker and a nurse and a primary care provider and a specialist and a home health care worker and a psychiatrist, and they're all working on the same case with the same patient. And each of them come with varying understandings and backgrounds and opinions about cannabis. So you may have, the nurse and the social worker saying, I'm so glad you're using this medical cannabis because you've really been able to reduce your opiate use. And I think that that's really positive. And your family's noticing that you're a lot different, and that they're getting more of you, and that you're having less side effects, and you're not asleep all the time. And the psychiatrist might say, you're trading one addiction for the other. And, you really should be abstinent. And our whole goal should be to get you off everything. And the primary care provider might say, just take your opiates as prescribed. I'm prescribing this to you. Me and your pain specialist feel that this is the best way to treat it. We don't have enough evidence that cannabis can be helpful in this way. And so when you have an interdisciplinary team that all comes with different approaches, different levels of education, different experiences, and different feelings, because let's face it, feelings are involved here too, about cannabis and what its utility is, we already have such a fragmented healthcare system, and this definitely doesn't help the patient by not having all of their care providers on the same page.
That's such a good point. That's such a good point, Dean Easter. What's your thought about that?
Just if we're talking about how it has changed, we've had a lot of healthcare professionals come into our program. So we have different programs that are 16 credit, or we have a 2-year program. And we've noticed that initially we had a lot of nurses who are, I would say, more open-minded to the evolution of the field, or they wanted to open their own clinic with their medical background and adding the cannabis expertise to that. We've also had a lot of pharmacists who understood the molecular component associated with all the different cannabinoids and terpenes, et cetera, but they wanted to understand more about the endocannabinoid system. And we've even started teaching it in the A&P in classroom. We're talking about the first thing that we teach in anatomy and physiology is homeostasis of the human body. We have started to implement talking about the endocannabinoid system within that curriculum. So our demographic of student has changed drastically because we are a 2-year institution. So we are having people with PhDs coming back to a 2-year institution to be able to learn they thought they were going to learn how to, like I always say, grow cannabis in their basement. No, we are talking about the science, how this is binding, this G protein coupling, all of these different components that are associated with this, with the different cannabinoids that are present. So our student demographic and the interest level from medical professionals I do start to see that change. And it's also pushing our students to become more interested in the medical field because they are getting a taste and understanding the endocannabinoid system, which is tripping them out because if you think about when you learn something for the very first time, think about as old as we are and young we are, when was the last time we heard something brand new, right? So our students are being exposed to that, and it is pushing them to want to become biochemists, to want to enter the medical field, to get people who look like them in front of patients to listen to them. So that's where I'm starting to see the change, particularly more people wanting to go into the healthcare field to advocate for that.
Yes, I totally agree with you that, how exciting the endocannabinoid system. And I've been teaching for such a long time. There are nurse practitioners are there, MDs are there are pharmacists are there. They are really interested in that system and the interaction with the phytocannabinoids. But the shift and the change, what I am also seeing by coming these days, from last kind of couple of years, is people are not only interested in those areas, but they are also understanding that this is such a big field, and it is such an important field that you have to understand A to Z, seed to sale, to treat the patients in a better way. So they are more interested to more learn about that. Okay, what is extraction? What are the different extraction processes? What are the advantage of these extraction processes? What exactly that, like I always tell, because I ran the cannabis testing lab as a scientific director for 2.5 years, and I understand that the quality or purity and potency of the cannabis products are really, really critical in the field to give the patient the safety. And I think that it is the most unappreciated field, that we are not lot of testing courses are there, or most of the people understand about the certificate of analysis, or like why there is like various different tests we are doing it. So now I can see that the switching the gears from various different perspective of nurses and pharmacists, etc. They wanted to understand that like why we test that, what are the value of this test, and how we read the COA, and not only that, that like how we can tell and how we can ask the provider that like I need more data, because they are understanding the value of the terpenes and terpenoids and flavonoids and overall the entourage effect in the cannabis treatment, which is really, really important. And now they are kind of like more open to that and extending their knowledge and try to extend their knowledge in those areas, which is really, really fascinating and encouraging for all of us. One of the important thing that we always talk about, that like as I was talking, that like without understanding the efficacy and the safety of any drug, including medical cannabis, we cannot use the drug in a very effective and efficient way. So Peter, what do you think about that, like last 10-15 years, that like what kind of research is coming, that which is kind of like showing more that like the efficacy of this the plant and the safety of this plant, respect to not only the preclinical studies but also a lot of clinical trial with respect to medical cannabis?
Well, the studies are getting a lot better. It's hard to keep track of them all because there were 4,000 studies last year and 4,000 studies the year before.
Yep.
You could literally spend all your time reading studies and not do anything else and still not keep on top of them. But the fact is, like, during the war on drugs, starting, the United States government produced funded 80 to 90% of worldwide drug research. It still does. And between NIDA and the National Institute of Health, we really were only focused on finding harms of cannabis, not benefits. To get any money to research cannabis over the last 50 years, you had to show a drop in something. You had to drop sperm count, IQ, motivation. Something had to be wrong or you just wouldn't get funded. I read a lot about this in my recent book. You really have to disentangle the social history from the science with cannabis more than with anything else. With psychedelics too, but really with cannabis. But now more recently, first of all, in other countries, Canada, Europe, and Israel in particular are doing a ton of really good research on medical cannabis. So it's not just the United States who's waging this like terrible war on drugs, controlling all of the purse strings. These other countries are now more independently doing research. And then second, like people are just tired of the nonsense. They want to hear, and it's really interesting. Like if you see a new study that comes out, who's going to be in favor of it and who's going to criticize it based on the results. Like half the people, if it shows anything positive about cannabis, will just shoot it down. And the other half will shoot it down if it shows anything negative about cannabis. But, really we need to sort of evolve beyond this like really intense polarization. Like people who treat people with cannabis or people who use cannabis should want to know about the harms, because then they can make an informed decision. We know the harms of alcohol, and you still might want to have a beer or two at a barbecue, but you're making an informed decision. And people who are against cannabis should want to know if it helps people. There's only so far you can kind of beat that ideological horse to death. The American Medical Association still puts medical marijuana in these derogatory quotation marks, like it's just some like hippie fantasy that has no reality. And the fact is, again, there is more and more common ground for cannabis. And I just really wish that both sides were more open to what the other side has to say, and that, if a study comes out, we should judge it on its own merits. Was it a good study, regardless of whether it shows something that we agree with or we don't agree with? That's just confirmation bias. So I think the studies are a lot better than they used to be. And I think that the next step is to get people to sort of read the studies more open-mindedly, everybody across the spectrum, so that, again, we could all come to greater common ground. And this could be one less topic that we all fight about.
No, I totally agree that when you talk about the research and when you talk about the efficacy and safety, that I could not more agree that, I kind of like digging around every day that what research studies are coming, and you cannot catch up. There are so much studies are there, and the studies are getting better and better every day, and so many different diseases either it is cancer, neurodegenerative disorders, anything you name it. All the different clinical trials are running, also preclinical trials running. So in that end, I think that we are doing an amazing job globally. We all are fighting. The one important aspect is that, like what I see also, that, like totally agree with you, that the funding situation is really pathetic, and we need more funding to explore this plan, to explore this amazing system. And there are a lot of funding is coming little bit here and there, but that's not enough. And being a dean of an academic institute in the urban agriculture, I would like to hear Akila Istra's perspective, that what you guys see with respect to the funding, that, like either there is a easy route to get the fundings for your program, or if there's a easy route, or things are getting easy to students get funding, the scholarships and internship, etc., or there's a kind of like a pretty good challenge there.
Yeah, there's definitely a challenge. It's just as murky as legalization. We will be writing for a grant. We've asked all the questions, preliminary questions, and then they'll say yes. And then suddenly we're about to submit. They're like, no, you can't submit because it's not federally legal. We brought this up at the very beginning when we were asking our preliminary questions, but it seems like once it gets down the pipeline, we start to get those no's. So finding funding has been difficult from that national component. The city of Chicago, though, has supported us a lot with regards to the MSOs, with our social equity, providing funding to support. The city of Chicago is actually bringing a research institute to the city. So we'll be in the heart of the Midwest, which I think is a good location. Maybe I'm a little biased, but a good location if we're talking about this research where it can reach out and spread throughout the United States. But I think that they are taking that serious component of research is needed. And the research institution is funded by the state and the city. So that's where you're going to see that combination. Now, USDA has supported us significantly. That's where our vocational license is through. They have offered opportunities for us, but then they started to explore and understand the federal law. While at the state level, they love us, right? But then I guess they, like I said before, ask a few more questions, and that federal starts to block us from the funding opportunity. Unfortunately, our institution is very much behind our curriculum, and we are, under urban ag. And I will say that was a fight too. I was at another institution where I was writing the curriculum. So we're sister colleges. We were writing the curriculum, but nobody would house us. So I was teaching biology and A&P. We tried to put it under there. They wouldn't house us, right? So then we literally started a whole department so that we could house the curriculum under cannabis. And we had the funding to support it. That was the first thing they asked. So we had the funding to support it. They supported us with building facilities. So we have a greenhouse where we actually grow cannabis and test it within there. So our institution has definitely supported us, but we hit roadblocks when we're trying to get that federal funding.
Yeah, so I think that the complexity.
Also, grants in the city within our grant. So the R3, there's different grants that also support social equity. So I apologize for interrupting.
Yeah, no worries. So I think that, the overall that we come with that point that, the complexity, the regulatory complexity and the policy complexity of the federal and the state level creates such a challenge to bringing those grants. Amanda, what do you think about that?
Well, funding, yeah. I mean, what Akila and Peter have said has always been a challenge. Just wanting to fund things that were going to support the federal government's position on cannabis, basically, that it's really, really harmful. Now, luckily, since legalization, we've had opportunities for funding to come from the state. So here in California, we have a set aside for our cannabis revenue, tax revenue that goes to fund research at public universities in California, which we have many around cannabis research. So they're kind of taking up where the federal government has left off and, bringing in opportunities to do the research. But I feel like what we've basically had to do over these last 40 years is like reverse engineer the research. Like we really started with large populations of people saying, this is working for me. This is benefiting me. Like this is really helping me. But we couldn't get the funding to figure out why, or like what was the mechanism, or to do the trials to try to prove causation versus correlation. And it's only recently that we've actually been able to take what people have been claiming cannabis is doing for them for decades and actually take it to a controlled environment where we can say, oh, this is why. This is why it's helping for pain. This is why it's helping for spasticity. This is why it's helping. And people, with who use cannabis have lower COVID mortality. Like, this is why. And I think it was the why. That's what you really need in order to develop medications, right? You have to understand the mechanisms, and then you have to be able to standardize those mechanisms through a product. And cannabis has always been really difficult, especially because of the FDA mandate of one molecule, one reaction. So we talk about the cannabis plan, and we know the entourage effect. We know it's not just THC. It's all of the cannabinoids and all of the terpenes and all of the things working together in harmony in order to give that reaction. So I think it's just been so difficult to fit cannabis into the model of what medicine means in the United States. And then that social stigma attached to its use really made it easy for the federal government to say, well, we're just not going to touch it. I applied for an R21 grant back in 2007 to do a national cannabis survey, similar to how they do the national alcohol survey. We didn't have legalization yet, but I knew it was coming. We had horrible questions about cannabis use among the general population, and I wanted to really dive deeper into how people were using cannabis. Yeah. And the grant was scored but not funded. But when I read the comments, half of them were like, why aren't we doing this? Like, we need to do this. This is so important. And half the comments were, did you Google this lady? She's obviously a legalizer. She obviously just wants cannabis to be legal. We should not give her any money. And so, just that kind of reaction to wanting nothing more than to provide information that would help make better policy decisions, better healthcare decisions, really shows how much the propaganda has infiltrated what is supposed to be a very objective measure of scientific value.
No, I totally agree. And one of the important thing in this field, when you talk about the drug discovery, that drug discovery process, I've been in the field of drug discovery and especially focus on the cancer drug discovery for such a long time. And I know the pain, because one drug from the laboratory to go to the clinical trial to get approved from the FDA it takes at least 20 to 30 years. And we have that leverage with the medical cannabis, where we are using with people directly and bypassing this, all the laboratory testing, all the preclinical testing, etc., and gathering the data. It should be very fast. But again, the complexity is there because it don't fit. Because I've been a regulatory consultant for a couple of years, and I understand that FDA has a very strict regulations. I need to see the safety, I need to see the mechanism, and I need to see the mechanism that where is the target, where is going to bind. But you can't do that with medical cannabis. Just example of CBD, more than 46 different targets in the body. How it's going to fit with one strong fit? But on the other hand, I think it's a big success for all of us that Epidiolex is approved from FDA for Lennox-Gastaut syndrome and Dravet syndrome, which is really a great success for all of us. Now, the question is that, when we talk about the healthcare providers, I think that it is really important for all globally, as well as that, in the country-wise, that healthcare providers should stay informed about the latest research and development in the medical cannabis therapeutics related to the education as well as research, and there should be the strategies and what kind of strategies can be implemented to improve the medical cannabis education amongst the healthcare professionals. So I wanted to hear Peter's thought about that, and then we will go for the other panelists also.
Well, I think that for medical cannabis, it's just a question of context, like contextualizing it. There's been so much hype about the harms, and then, so little research into the benefits, and then contrast that with what patients are saying. Now 94% of Americans support, legal access to medical marijuana. So there's been quite a chasm between what the doctors think and what the patient thinks, but that's really narrowing. We're definitely making progress. But I think the context that's needed is that when we use medical cannabis, like when I start a patient on medical cannabis, I'm not claiming or, touting it as something that has like no side effects and is like completely effective. The fact is, like with any clinical encounter, with any medication I prescribe, I try to prescribe the least harmful drug, which isn't to say cannabis is completely harmless. As we talked before, it's not particularly safe or known to be safe in pregnancy. It's not safe for teenagers, unless they're like chronically ill or have some really good indication for it, like my brother Danny did when he had cancer. And it can definitely destabilize people with psychosis. So, we're not saying it's like completely harmless. We're just saying like it's probably less harmful than the other things that we'd be using. Another example would be sleep, insomnia. Like it's very hard to argue that Ambien, that a ton of people use, is safer than medical cannabis. It affects your memory. It can cause dementia. It's implicated in car accidents. People eat everything that's in the refrigerator and then wake up and say, who ate all the junk food? And then they don't, that's like, oh, it was me. I was an Ambien. They're like in these like dissociative states. So, if I treat someone with penicillin for strep throat, they could have an anaphylactic reaction. But penicillin's often like the least harmful thing to treat strep throat with, because most of the time it works and it usually doesn't give any side effects. But is it absolutely safe? No, it's not absolutely safe. There's no free lunch in medicine. There's no medication or drug that's like completely safe. So with cannabis, we're trying to treat these common things like insomnia, chronic pain, nausea, anxiety, where the alternatives are not particularly helpful or particularly successful. So again, it's not, is cannabis completely safe? It's, is cannabis a less toxic alternative likely for these things we're trying to treat? And in this case, in these examples, it often is, not always, but it often is. If someone has a history of psychosis, you probably wouldn't use cannabis. You probably use the Ambien. But so I think it's just a question of context, because the doctors have been bombarded with this narrative of like, this is harmful, this is harmful. But first of all, a lot of that's been exaggerated. And second of all, you just have to compare it to everything else we do and put it all in context. And when you contextualize it, usually or quite often is a less harmful alternative for whatever you're trying to treat.
No, I think that, like I totally agree with you that the way that, we need to approach to the healthcare providers and need to be that, like what are the harms and what is the realistic way to treat patients with medical cannabis with the support of the data set, that the research that which is globally happening will make a big difference once they get updated with all those things. And which leads to the another question is that how does medical cannabis education vary globally, and what can be learned from the different approaches, which is really, really important, because as we all are talking about that, we are not alone. We are globally fighting because it is coming from the Asian countries, and there's a huge, we are coming from a country like India, that when I was a kid, that like if this plant just grows like a weed in the side of the road, and like we just people use it for cultural infusion, also therapeutic infusion, also so many different things. So then if it is coming from so many different aspects of the globally, then what we are learning from that global information with respect to the cannabis education and how it can be benefited for us. So Dean Easter, we will start from you.
That's a huge question.
That was about 8 questions.
Right. I think we're really just fighting human nature, right? So how are we going to, so here's I was in pharmaceutical sales, so I call myself a legal drug dealer, right? So we were pushing, I shouldn't say that. We were, educating on these drugs that we knew some of the strong side effects associated with that. I think that's kind of the approach that we need to take with cannabis. We're supposed to have that unbiased education to the different medical doctors. And if we can kind of I tell my students, I said, you fell for the propaganda. I said, are you that easy to trick? Right. So I tried to do this reverse psychology with people of, can you open your mind to be able to understand? We across different countries, there's too many dynamics. There's religious, there's too many different things associated with that to be able to figure out what that full answer would be. But I think that we need to, what Amanda was saying earlier, reverse, we're going to take it back of educating doctors, of going into the different offices and just letting them know, hey, I'm not on any side, left or right. I'm just here to educate you just like I would about any other drug that I would be bringing in this briefcase that I'm lugging around, right? So I think that's what's going to take with changing that human behavior and having a certain level of respect of the science. When I still go to different science conferences and they still scoff at me when I talk about cannabis, right? So there's going to be that level of trying to get people to understand this is legitimate research. I don't know if it's going to be a popularity contest of having one of our famous scientists actually, legitimizing everything, because that's how we need to follow somebody, right? So we're going to need somebody who's going to lead the charge with respect to that, to change that human perspective, because humans are always in the way. I love humans, but we are always in the way. And just understanding that these concepts are just like any other medicinal product that is being utilized and provided within the field. Just like Peter was stating earlier, we talk about the harms and the positives associated with any type of drug, whether it's morphine, whether it's aspirin, all of those different components. And that's how we need to start to articulate. And I think we need to change the different classifications associated. This is all opinion. Change the classifications associated when we talk about cannabis, not talk about it from that sativa and the indica, but talking about it. This is the percentage of THC. This is what it could possibly affect within the human body, those different types of things. Once we start to put that scientific language onto the science, instead of letting the general language lead as it has, and the cartoons and all of those different components, that's when we're going to see a turn within the concept of understanding cannabis and utilizing it. So I hope I answered one of those.
No, I totally agree. And one of the things that what you mentioned is that, like we need to use a common language, and which is really, really great, and which is really important for any medical profession to use any drug. But again, that it is not that simple in the case of medical cannabis, because the complexity is too much, the variability is too much, and the variability what we are seeing and what we are facing for each and every and different aspect. Because when I was in a testing lab, that even though within a state the variation from one lab to another lab is so big that you cannot compare even apple to oranges there. So if we are talking about two labs within a state, then there are so many states are there, and there globally we are talking about. So it's such a big challenge that we are seeing. And then after that, we are talking about chemotype, chemovars, and various different kind of species and their origin globally, that like it is coming from Asian, and then it's go from here to here. And then after that, like people are growing in home, people are growing like in their indoor, outdoor. So there are so many variables are there. And along with that, even though we standardize all those things, the testing is not standardized, the process of extraction is not standardized. So then like it's all we are seeing that that there's a variable, there's no variability, but there are so much variability. And along with that like now there's the advancement of CRISPR-Cas technology, which is a advanced gene editing technology in the hand of the agriculture geneticists. They are producing so much because of the human nature of the discovery, so much hybrid plants that we are seeing every day, the new product and the new plant. And then their existence is only for 6 months because we are playing with the genetics of the plant. Then it's too much variability, but still there's a huge room to learn from each other globally. And the example I can give you that like for example, that India been using traditionally medical cannabis for such a long time, but now that government started actually recognizing that, and it is coming in a very medical level that people are trying to use it and share the medical knowledge. But they are utilizing this knowledge that what we have been done, Canada has been done, European countries has been done, Israel has been done. They have that quality material. They have the species which grow in Northeast and Upper Himalayas also. But now they have all the tools that which can be easily, they don't need to standardize that. And globally, that when different countries are using and showing their clinical trials, then we are collecting the various different ethnic clinical data, that which is really important to tell the world that how impactful this plant is and this medicine is. Now that actually turns to another question, is that how can patients be better informed about the potential benefit and risk of medical cannabis? Amanda?
Well, this is tough because, as Peter was saying, we have kind of these two ends, right? It's like either cannabis is terrible, horrible, never use it, it's the worst thing you could ever put in your body, or it cures everything that you could ever imagine and has no risk at all. And I understand why these two poles exist, right? The first was started under propaganda, wanting no one to use cannabis, wanting people to be afraid not only of cannabis, but of people who used cannabis, which was really kind of the impetus for drug policy in the first place. Right. And then as a reaction to that, activists really couldn't show any kind of sign of belief about harm because the prohibitionists would run with it. So if you believe cannabis was legal and you said, but teenagers probably shouldn't use it, then the prohibitionists would say, see, even the activists say that it's dangerous for teenagers and therefore we shouldn't legalize it. So you kind of had these two camps that emerged as a result. One that said cannabis was terrible and one that said cannabis had no risk. Now, of course, then the industry came along, and the industry isn't going to play up risk. Even the alcohol industry that tells you please drink responsibly, they don't say please drink less. So, the messaging around how the industry approaches cannabis hasn't really left a lot of room for that middle ground. Thankfully, I do think that people like myself and other public health professionals are starting to kind of come forth and say, look, cannabis is not attached to a moral decision. Cannabis is a plant that has very good things about it and also has some risks. And like Peter was saying, if we want people to develop long, healthy relationships with the cannabis plant, we need to teach them about how to maximize benefits and reduce risk. We need to teach them that not all methods of consumption are the same when it comes to health risk, that if you're a long-term cannabis consumer, you probably shouldn't smoke. We need to talk to them about some of the impacts of cannabis, in terms of impairment and what that means and how that's different for different people. We need to talk about drug interactions and what pharmaceutical medications may not work well with cannabis or may have diminished capacity because of cannabis. We need to talk about family history of psychosis or personal history of psychosis and the care that should be taken. We shouldn't put pregnant women in jail for using cannabis, but we should absolutely educate them about what the risks are of using a substance like cannabis, while also recognizing that some women do use cannabis during pregnancy because they have very, very severe nausea, and it's the only thing that helps. So unfortunately, kind of going back to this global perspective, in America, we are really bad at moderate views. We really don't like to live in the middle where things are both good and both bad. We like to either pick a side and I'm good and you're bad, or you're good and I'm bad. But, cannabis has been around for thousands of years. People have been using it for thousands of years. If we want to keep using it for another 1,000 years, we're going to have to adapt to the fact that capitalism, industry, advocacy, propaganda have absolutely impacted the way we talk about cannabis. And so we have to, at some point, put that aside and give consumers a source of truth. Because otherwise, they're going to reject both sides, and then they're really not going to know how to use cannabis safely and effectively.
Thank you so much, Amanda. And I think that, we are close to the end. So closing remarks for one very important questions, and get to understand that, you guys views before, and I will start with Peter because he need to leave, that how you see the future of medical cannabis education in healthcare, and how can stakeholders collaborate to advance this field?
Well, I think the future is bright. I think we're going to come to more common understanding about what cannabis can do and what cannabis can't do. And I'm hoping that it's just one less issue that we all fight against. It helps people. Very few people are against medical marijuana. And I think the more that people understand like the social history, they tend to be against the criminalization of cannabis. At the same time, as Amanda points out, both sides are so, there's so much confirmation bias. Both sides are so sort of set in their beliefs. And I just think that, the U.S. government's done a real disservice to everybody by putting out so much nonsense about cannabis and all the other drugs, by the way, not just about cannabis. I've had patients say to me, why should I believe you about a COVID vaccine? The U.S. government lied to me for 50 years about cannabis. I mean, the only thing you really have in the end is your credibility. So I'm just looking forward to getting more doctors on board, having more, collegial discussions with them, understanding their concerns, and then, continuing to get cannabis. Maybe we'll get it put back on the pharmacopoeia. It was in the pharmacopoeia in the 1850s. And then when it became criminalized, it was taken off the pharmacopoeia in the 1940s. Maybe we'll get it back onto the pharmacopoeia one of these days. But I do have to sign off because I have another event in about a minute. So I just want to say thank you to all you guys, and that I really enjoyed this conversation.
Thank you so much, Peter. Minister, your thoughts about the future of cannabis education in the healthcare system?
Nice to see you, Peter. Nice to meet you. Well, I think it's bright, just as Peter said. I feel that we're going to have some cannabis advocates out in the field. I think public health is going to, because our medical cannabis is housed at within our public health department. I think they are going to start to create these educators, because there's no going back. Once we have legalized it within our state at the medical and recreational level, where can you go from there? You have to be able to create the field of having these educators. I think our students will be examples of those educators. We have people with 2-year degrees who are specific in this topic, not speaking for the medical aspect fully, or not speaking as they are doctors, but they can still go within their communities and have a strong foundation for being able to articulate to our communities what is really going on with this plant and how it could save and benefit our communities, even though there's so much stigma still associated within our communities. So I think if we have people who look like the people that are represented within the community going and saying that this plant can be more beneficial, they will listen. So I do think that it's going to be bright. We have students who, like I said before earlier, want to go into biochemistry because of this. I think we're going to have more researchers from diverse backgrounds that can give different stories and different narratives as it relates to this. But we are also focusing with my students, I want them to understand, to be scientists, right? To remove that bias, to be able to articulate things from a scientific perspective. So I think we are creating a more sound science in cannabis studies. And that's why I feel like it's bright for you know what I'm trying to say.
Thank you so much. Okay, very quickly, Amanda.
Yeah, well, I agree with everything that's been said. And I'll just add from a pragmatic perspective, there's something called aging out. Right? People that grew up really impacted by propaganda, really impacted by prohibition, buying into that whole narrative. They're getting older, they're retiring. And the people that are coming into the field grew up during an age of medical cannabis. They knew cannabis as a medicine their whole lives. They never knew it as a prohibited substance. They've seen people in their lives benefit from it. And that makes a huge difference. It makes a huge difference in terms of what courses are offered, who's interested in taking them. Medical cannabis and cannabis medicine becoming a viable path for young scientists, where now they can actually study at a school like Morehouse or Berkeley or Harvard or Johns Hopkins and specialize in cannabis medicine. That's something that didn't exist even 10 years ago. So those opportunities, I think, are really going to drive the field and drive the collaboration that we need to make cannabis more of an accepted discipline.
Thank you so much. Thank you so much for this great concluding remarks. I think that, overall, that what I'm hearing from all of you, that, that in my perspective also, that cannabis education is such an important field. And, with this education, with this tool, that we can change the field, because it's all about that what's going on in the field and what are the great things happening in the with respect to the research and with respect to the product quality control and standardization and policies, etc. Everything we can do it with the help of the education. Education is the power, and it is going to change the things. So thank you so much for you guys to joining us today, and it being a great conversation, it being a great insights about the cannabis education and changing the healthcare perspective from all the experts in this field. And I really enjoyed the panel discussion today. Thank you for joining us today.
Thank you for having me.
Thank you.